coming to the ethical issue, First Minister, as someone born outside Great Britain who spent their career working in the NHS, I can personally attest to the contributions overseas doctors, nurses, healthcare professionals and carers make to our health and care system. But I'm also acutely aware of the downsides of our reliance of overseas workers. Namely, we are denying their country of origin of their talent. As a doctor from Kashmir, one of my biggest regrets is the fact that healthcare in my country of birth has continued to decline with nowhere near enough medics. It is the same across the Indian subcontinent, the Philippines, and large parts of Africa. Their best and brightest come here for better wages and working conditions, while healthcare at home struggles to find staff. First Minister, do you agree that our reliance on overseas staff is doing a disservice to many poorer nations, and will you outline the concrete steps you are taking to train and retain British citizens as doctors and nurses?
Well, I thank the member for his question. I do want to just recognise that I don't welcome his views on politics. We disagree, we're in different parties, but I do recognise and welcome his public service contribution in our health service. It's part of the success story of our NHS. If anyone goes into an operating theatre in any NHS hospital in Wales or across the UK, they'll see that international success story in front of them. It's part of how health service was created and how it's sustained. In addition, of course, we do continue to invest even more in training record numbers of staff here in Wales. If you look at nursing numbers, midwifery numbers, physios, a whole range of areas where we've deliberately increased our investment in training, and the Health Secretary set that out last week. That's in addition to what we're doing in the new medical school we'll open in Bangor, in addition to what we've successfully done in the last 5 to 6 years in sustainably increasing GP training numbers as well. In addition to that, we do recruit people from other parts of the world, and we do so in a way that is sustainable and ethical. A good example of that is in Kerala, an Indian state where they deliberately overtrain and oversupply health and care professionals. We have an agreement to recruit 250 nurses and doctors from Kerala because we have an ethical partnership with them. And this is a deliberate choice where people want to work in other parts of the world, where they still have family links to go back, and we're proud of the duality in that. I'm someone who was born in a different country as well. I'm here and I'm perfectly capable and able to celebrate my mother's heritage, the place of my birth, and my father's birth in Ogmore by Sea. That's who I am and part of the story of our country and the success of our country moving forward. So we'll continue to train and recruit within Wales and the UK. We'll also continue to undertake ethical recruitment from other parts of the world, and the Kerala agreement that the Health Secretary signed with the Chief Minister of Kerala is a good example of that.